Yeah, good afternoon, all our listeners and our viewers. My name is Dr. John Usozi. I'm a senior medical officer at Edpa Hospital, Hoima branch. And today I have a very important topic to talk about. I'm interested in discussing a few diseases, a few complications that affect our urinary system, majorly in males. And if you can be cancers, can be strictures, can be enlargement of the prostate. But let me give you highlights and we see what we do, how does it present, what is the solution. Let me start with the prostate cancer or prostate enlargement. A prostate is an organ that we have in all our male reproductive system, and it has a seminal duct because it produces semen at the end of the sexual coitus. But however, as we have it along the way, it may also become a problem to us, and it may enlarge. It may enlarge and remain in that area. It may also enlarge in the form of cancer. Cancer spreads from wherever it is, goes to the lungs, goes to the backbone. So sometimes you may come up with some complication, which some people take lightly, but at the end of the day, you find that they have a very bad consequence on our lives. Sometimes maybe some people don't know. So you may find that when you have an enlarged prostate, sometimes it may come at the age of 45, 50 and above. Or maybe when you have a history of the same disease in a family. My daddy died of cancer of the prostate, my uncle. So if you're there in such a history, in such a story of the family, you are the right candidate I'm looking for. I'm looking for the males because they are the people with the prostate. So when you have a prostate problem, when you have a prostate disease, how would it present? How would you know maybe you have a prostate enlargement? One, you may have difficult off area to pass urine at all the time, or even you may find it very hard to pass stool. That is constipation. So you find some people also having complete voiding. So you find you're straining also, maybe you're urinating, you're not finishing the urine, but all the time you want to go back to urinate. Every time you want to go back to urinate. My friend, you need to examine whether it is the problem of the prostate. Then there are those people who sometimes you pass, you pee, but you see blood in the urine. So sometimes you're the candidate I'm looking for. Please, there's also what we call a racial stricture. So you find some people have had a lot of recurrent infections all the time. They keep treating, sometimes they fail to keep treating. Those people with bad sexual habits, you're at risk. You are the candidate today I'm talking about. So you find it hard to pass urine. You find it so sometimes even what we call incontinence. You understand? So that one is not very common also in the prostate enlargement. So there are those also who had complications also in the bladder. You find you have tumors, you have cancers of the within the urinary bladder. You realize that at the end of the day, you are the candidate I'm looking for. So if you think you lie in such category whereby you find it hard to urinate, sometimes you fail to urinate, you use a lot of force to push out the urine. Sometimes you see blood in the urine. Sometimes you have even pain around the down area of the abdomen. You find you have also back pain. Sometimes even you find it very difficult to pass stool. You are the people we need to see. So why have I said this? Because we have a very big chance. We have a very big team coming from Kampala and also within our team. 23rd to 25th of August, we are here at Edpa. Please come. We have a medical camp for what we call a urology camp here at Edpa. So if you think you have a similar, but also those who don't have the same problem, but could want to use the same opportunity to come and do the testing, please, you are very, very, very welcome because by fact that you're male, you are at risk. So on 23rd, 24th, up to 25th, please avail yourself, come for medical checkup, come and we do better thorough investigations. But also those who have a problem, there is a very good chance that you'll get a better spot-on management by what we call transurethral section of the prostate. Some of you just hear about the procedure, but it will be taking place those days because these are better machines, these are modified machines, less invasive that we can always try to help you So we are waiting for you. Come August, come. There will be a big team. You are highly welcome. Actually, the registration taking place because it is a camp. We want to know our clients who are coming in, who will be coming in, so that we take records as early as to make an appointment. Because even those who have issues, we want to to make appointment with you earlier so that we can plan in advance. So for those who have had and those whom we think you have relatives, you have friends who may have the similar problem, who may benefit from this camp, please, wherever you're from, any region you are, please utilize this chance and we see better urologists from Kampala come 23rd, 24th, 25th August. This year we're waiting for you. I remain Dr. John Psolozi at Edpa.